Hi, everyone. Welcome to the podcast. Thanks for tuning in.
Happy Monday.
Happy October.
Yeah, whenever you're receiving this podcast. Happy day to you.
That's right. Last week was actually our first October podcast. I forgot about that. Yeah. But this seems like the first October podcast because it's actually raining. We're supposed to get a storm this weekend.
Pumped.
I'm so pumped. Everyone says like, oh, a storm's coming. I'm like, yes, bring it on. As long as you don't have big trees in front of your yard.
Yeah, it just means that there's more times for sitting all cozied up and reading books, you know?
I like this. I like this idea. Maybe we should ask somebody about books. I'm just trying to think. Do you know anybody that knows a lot about books?
I mean, I do know one person who knows a lot about a lot of things, and specifically books.
Is it Mr. Friedel?
I don't know what kind of books he likes to read. But you know who does like to read a large assortment of books is Miss Stacy Wright, our school librarian.
Oh yeah, let's invite her in. I think Mr. Friedel only reads Tom Clancy novels anyways, so nobody
and car manuals.
Yeah, that's true. All right, let's bring in the wonderful Miss Stacy Wright. Welcome, Miss Wright.
Hey, thanks everybody. Hey, Mustangs. For this week's look at books, I dipped into the nonfiction section a little bit, and I wanted you to know we have a lot of books on important topics. And since today's theme is mental health, I went and pulled a couple of our books on mental health. And I think one of these was even recommended by Miss Henson. So the first one is Depression, A Teen's Guide to Survive. And it has a lot of really good, a good explanation on depression and anxiety. It really does explain not only what depression is, but also different treatments, and also has a wonderful reading list and resources in the back. So, this is just one of many books we have on mental health. But the one that I wanted to really focus on today is one called Your Brain Needs a Hug. And the subtitle, or the little title beneath it, is Life, Love, Mental Health, and Sandwiches. And this is a book on how to take care of your brain. And it does have sections on things like anxiety and depression, the effect of social media and the effect of stress. It also has explanations of eating disorders and all kinds of topics that can affect your brain. And the purpose of it is to really help students, young people, understand that you need to give yourself a break. You know, if you have depression, if you have anxiety, if you have an eating disorder, you should not be hard on yourself. And if you know somebody with a mental health issue, you need to also give them a break, because this really does affect a large percentage of the population. If you don't know anybody who has a mental health issue, if you don't have a mental health issue, you probably do, but you will before too long. And again, it's one of those books that breaks things down really well. Your Brain Needs a Hug by Ray Earl. And it has a marvelous resource list in the back, apps, other books you can read, websites. So it's really good. And the subtitle really caught my attention: Life, Love, Mental Health, and Sandwiches. And you might think, okay, what do sandwiches have to do with hugging your brain, with loving and taking care of your brain? And the author wrote this book after she was in a store a restaurant, and she wanted a vegetarian sandwich, and they didn't have vegetarian sandwiches. And she found herself getting really angry, and she couldn't really understand why something so small, like not being able to get a vegetarian sandwich, affected her so much. And it really forced her to look at what was happening in her life, in her brain, and why her response was just so much more than she felt like it needed to be. So, especially if you are a person who's interested in mental health, you're interested in your own mental health, you're interested in studying mental health, I think this is a really good introduction to that. And the best part about it is why mental health is so important, why learning about it is so very, very important, because we are all impacted by it.
That's amazing. Thank you so much for saying that. And, there's usually a stigma too. It's like, I don't need mental health. I'm like, well, everyone has mental health. Like you have physical health and you're either healthy or you're not, or maybe you're struggling with something. It doesn't mean that you're crazy or you have a cold and you're going to die instantly or anything like that. But it's an indication that you could use some support and some TLC and some taking mindful moments in your life and giving yourself a hug and whatever that looks like for you.
Yeah, you just can't be too hard on yourself. And this is available for curbside pickup. I think you all probably know every other Wednesday starting October 14th, we are doing curbside pickup for books. Right now, this is not available on Sora, but we do have a lot of electronic books that do have mental health themes. So if you are interested in studying this, if learning about it, especially after the guest speaker today, I think, the Alderwood Middle School Library can hook you right up.
And what would a student do if they are looking for a recommendation, Ms. Wright?
Well, a couple things. You can email me at writes. Remember, it's not Wright D at Alderwood. That's Deirdre Wright. She's another teacher. I'm Stacy Wright. So you can always email me for a recommendation. And I also, to our counselors, if you find books that the library needs, please let me know, because we are always wanting to purchase those. And that's a really important topic in our library. And people check out our books on anxiety and depression and some other really, really important topics all the time. So they're very popular.
Can I ask too, really quick, the very first book that you brought up, who's the author?
I'm sorry. It's Jacqueline Toner, PhD, and Claire Freeland, PhD. And it's called Depression, A Teen's Guide to Survive and Thrive. And I like that it's written for teenagers. A lot of websites and books are not written for teenagers, but this one definitely is.
Yeah. And I think we made a recommendation a couple years ago to you, or maybe last year. It's hard to tell how many, I got an email that somebody was in 10th grade and I was like, what? And it's been this pandemic has just really skewed time for everyone. But we recommended a book called When Nothing Matters Anymore by Bev Cobain. So I think you have that in stock as well. Is that correct?
We have that. Yeah, we have a whole section on mental health. And so I just grabbed these two because they're so popular. But yes, we definitely have that and a lot of other really important topics.
Excellent.
So yeah,
that's a really good book too. I know I've given copies of that book by Bev Cobain to the students, and they've actually written me back reports about the book and how much they learned about depression. So just like Miss Wright is saying, checking out books, reading about it will spark an interest and give you very helpful information, maybe not just for yourself, but maybe for your friends. And I know one student in particular that read that book by Bev Cobain, and they decided they wanted to be a counselor after reading it because they're like, oh my gosh, this totally makes sense. And Bev Cobain is the cousin of Kurt Cobain, which, again, students, you can ask your grandparents who Nirvana was. But back when I was in middle school, it was a band that was very popular in the Seattle area. And the lead singer, committed suicide. and it was very difficult for a lot of people, especially in my age and my time coming back from there. And Seattle has historically, over the past couple decades, had higher rates. The Pacific Northwest have had higher rates of depression and struggles with suicide for a lot of different reasons. And so it's a really important topic for us in Washington State. Absolutely.
Yep.
Great.
Yep.
All right. Well, thanks, Mrs. Wright.
Well, happy
Appreciate it.
reading.
Ms. Henson was going to say something.
I was just going to say thank you, Miss Wright.
Yes, and happy reading, Mustangs. And don't forget about curbside pickup. I want to get you, whether it's books to help you with your future career or help teach you something or learn about something, or just a book to read for pleasure. I want to make sure you get those books. So check out the library catalog, and happy reading.
Great. Bye, Mrs. Wright. So cool. Phil and Jessica, why don't you take a moment to just say hi to everyone, let them know that you're here hanging out.
What's up, AMS? Good to be here.
Jessica.
Hi, everyone.
Cool. Phil and Jessica are wonderful.
We love our interns.
Oh, super. We're so lucky. We tell other people at counselor meetings that we have interns, and they're like super jealous too. Yeah, definitely.
We love you guys. And we love the students.
Yes. and we see you, you're probably seeing them because we're trying to do a lot of home visits, or during pickup, you might see Phil and Jessica around. So we have a lot of counseling support for you guys this year, and you're definitely in good hands working with us. Hopefully Phil and Jessica, you guys just got some book ideas too. You guys are in school to be counselors. So now you guys have some reading material for some of your classes maybe.
Yeah, do they let us check out books too? Because those sounded really interesting.
Absolutely. Yeah. And actually that Bev Cobain book, When Nothing Matters Anymore, Miss Henson and I got some counseling funds last year, and we actually purchased like 20 copies each, something.
Yeah, we got a bunch of them. Yeah,
so we actually have some to give to you if you need a copy of a book like that and you can't get in the library because they're all sold out now or checked out now. We can maybe give you a copy. So.
Awesome. I wrote down all these titles, so I'm going to check it out. So if you guys want to read a book or read it with me, let me know.
That'd be cool.
Love that.
All right. Well, we have an incredibly special guest. I think we all feel very fortunate to have a guest of the caliber that we have coming up now. Kind of sticking with the topic of mental health awareness and a lot of those similar type of issues, especially during the pandemic. We have a very special guest joining us named Dr. David Schonfeld. Are you excited about this, Ms. Henson?
Oh my gosh, absolutely. This is definitely this is like our next level guest here. We're like up in our ante here, Mr. Webb.
We're setting the bar so high, we're going to have to get like, I don't know who can top this, but hopefully we can. So we'll let him in without further ado because we have a lot of important questions for him. But joining us on the podcast, all the way from sunny California, because I know right now it is so wet and rainy. I'm starting to even struggle with how wet and rainy it is. But this gentleman is in Southern California, probably enjoying 70-degree weather. Dr. Schoenfeld, how hot is it down where you're at right now?
I think it's in the 60s, getting up to 70. But we have wildfires, so it's not good air quality. Yeah.
I totally forgot about that. We had some of the smoke come up here a couple months ago or a month ago.
Yeah, but so nothing like you guys are experiencing there right now.
Yeah, we've had bad air quality for over a month, so we can't really go outside much. We're hoping it will end.
Yeah. Well, we'll hope that our rain heads your way.
Thank you. We'd appreciate it.
Or you can just come up and visit us anytime you want.
Yeah.
So we're supposed to have a rainstorm this weekend. But Dr. David Schonfeld is here. He is a medical doctor, and he is a developmental-behavioral pediatrician. And he's also a professor of clinical pediatrics at the Keck School of Medicine in the University of Southern California, which is USC to you kids out there. And he also works out of Children's Hospital in Los Angeles. He is also the director of the National Center of School Crisis and Bereavement, which has been helping many schools and students throughout the nation for the past few decades with intense serious crises that they experience, and helping them with extremely helpful consultation and advice about how to help and support students. As a developmental pediatrician, that is definitely an area of expertise for him. He's also a very popular author. He's authored over 150 scholarly articles, book chapters in different books. And we are very, very fortunate to have you, sir, on our little podcast here today.
It's good to be here. So thank you for inviting me.
Absolutely. Yeah. So one of the questions that I know right out the gate that some students might have, I've talked to students personally who want to go into the medical field, and they want to go into even working with kids, in the medical field. And maybe even I've specifically talked to students who want to be pediatricians. So what does that type of career pathway look for you? I mean, like, did you wake up one day and decided you wanted to be a pediatrician? And, how did you start in another field and then decided you want to go there? What did that career journey look like for you?
So I was very young when I decided I wanted to be a physician. I remember announcing it at about 5. Now, my mother was a nurse, my father was a doctor, and I don't know, just at that time, I just decided that's what I was going to do, and probably had too much focus. I do remember taking piano lessons as a young child, and when I was told to practice my scales, I said, why would I practice them? I'm going to play the piano till I'm 18, and then I'm going to go to college and medical school, and I'm going to be a doctor. And I actually think I would have played the piano better if I had practiced my scales early on, but I didn't know that I wanted to be a pediatrician until I was in medical school. I just knew I wanted to be a physician. And so you don't really have to choose the specifics of your career direction too early. So I went to medical school. I decided at some point in medical school, I really did try and figure out what am I going to do next, and thought about internal medicine, obstetrics and gynecology, but then I just decided, you know what, I like kids. I want to be with them. And so that's when I decided pediatrics. And when I was in my pediatric residency, it was about halfway through, and the director of the program was just checking in on me and asked me, how are you doing? Do you feel like you've gotten what you want out of this program? And I looked at him and I said, I went into pediatrics because I like kids. And I said, what fascinated me was how they start as infants and then they end up as children, and they learn all this stuff really quickly. 2 years, 3 years, 4 years. I said, I really was fascinated on how that happens. And to be quite honest, I was in actually probably the top ranked children's hospital training program. And I said, I've gotten a really good education, and I now know how to take care of sicknesses that children get. I don't feel like I know anything more about what it means to be a child. Like, child development at that point, it wasn't really part of the training. They just didn't do it. And so he just looked at me and he said, you need to go into behavioral pediatrics. And he recommended the program, and that actually was the best one in the country and for what I was interested in. And then I went for 3 more years of training after becoming a pediatrician.
Yeah. So in addition to being a pediatrician, you're a developmental behavioral pediatrician. So how does that specific focus come into your career? Is that what you needed an additional 3 years of training for?
Yeah. So, you go to medical school, and then after medical school, you do residency. So I did residency for 3 years in pediatrics. So then I was boarded as a pediatrician, and then I went for 3 more years to learn about common developmental and behavioral concerns. And I know it sounds like that's a long training, but to be quite honest, I started the fellowship. When I started, it was only a 2-year fellowship, and it changed to a 3-year one. And they offered, do you want to move into the 3-year one, which includes research and academics? And at that point, that was probably the first in my life where I said, you know what, I actually really love what I'm doing. I'll keep doing it. Like fellowship, there wasn't any night call. I was teaching, I was doing research. I was really pursuing what I wanted. And so I was like, sign me up for another year. And from that point on, before I was training to become what I wanted to be in developmental behavioral pediatrics, I think I was finally what I wanted to be.
Can I ask?
But go ahead.
Oh, do you remember, was there like a specific moment when you were in you're in medical school that kind of stuck out for you, that you were like, because I know you said, oh, I liked working with kids, and I knew, like, I kind of think that I wanted to work with kids, but was there like any kind of like moment where you're like, oh, this is where I'm supposed to be, like this feels like the place?
To me, it's when I had the opportunity to kind of meet young kids that were relatives, and I remember some family friend, friends of my parents, and I would visit, and it was a toddler that was like 2, and for whatever reason, this kid became attached to me. I didn't see him that often, and so he would just, like, they put him down for a nap, and you could hear him in his crib, pounding, David, like he just kept chanting my name, and I'm like, what's this kid doing? Like this, he's so freaking cute. And I just got to a point in medicine where I was doing the training, and I realized, yeah, the science was interesting, the illnesses were interesting, but I really just wanted to be with kids. I wanted to figure out how, and it's the same thing. My research is school-based research. And when I was trying to figure out what my research career would be, I was like, I want to be in a classroom. I want to teach kids. So now I'm a doctor, so I can't just go back and teach, but I can do research in how to do that. And that gives me a chance to teach lessons and really then study, how do kids learn? Because that was what fascinated me. So it was a certain point where I just decided, you know what? I'm not going to do what's you're supposed to do or what's makes money or is prestigious. I went into this because I want to help kids. And so that's what I'm going to do.
And you bring up a good point, because a lot of times medical school seems really intimidating to students because of how long it takes to go through. But I think the point that you made is you were studying things that you liked. To be a counselor, it takes, you have to go through undergrad for 4 years and then another 3 years to finish. So it could take 7 years, but you're also taking classes that you want to learn for the most part. So that must have helped you as well.
Well, I also think, in medical school, you have your preclinical courses, and that's probably 2 years. But even now, they get you into clinical settings from early on, even in your first year. And so, yes, you're going through a lot of coursework and training, but a lot of it is clinical training where you're still helping people and you're doing what's meaningful. I mean, I will tell you, in my medical school, this was a long time ago, so there was a lot more independence. There's a little bit more rules now. But I had patients when I was in my first clinical year, in third year of medical school, who, I remember one kid, when I say kid, I think he was probably about 20, and he got into a motorcycle accident, and it was a bad accident. He came in and he ended up having to have his spleen removed. And so he was in the emergency room, and I met him and introduced myself, but he was kind of in shock at the time, like literally had lost a lot of blood. And so I remember on the last day, as he was getting discharged, he was on the phone, he was talking to someone, he said, "Oh, excuse me, my doc just came in," and he said, "You know what, I'm going to apologize. You introduced yourself to me in the emergency room, and I don't remember your name." So I told him my name, and he goes, "You didn't say doctor." I was like, "I'm actually a medical student." He goes, "You're a senior?" And I go, "No, actually, I'm earlier than that." He just gave me this look, and I said, "I did not do the operation. Trust me. I've just been following you, and they've been supervising me." But he just was like, "I thought you were my doctor." So you really did have situations where you were doing something that felt really meaningful, and you were learning stuff that it seems very vital and important. And so it's not like you're just taking courses because you have certain credits you have to reach. You're really doing something both that you enjoy, and I will say in medicine, like in counseling too, you're helping people. And if that's what drives you to the field, you start doing it pretty early in your training. So it keeps you engaged. It's the same way if you go to get a doctorate, PhD, that can take a long period of time. But you reach a certain point where you're not just trying to get to some place. You're already in the field, and it seems worthwhile.
So let me rewind just a second. So going back to maybe when you were in middle school or high school, and first off, one of the things we like to ask all of our guests is, were there any memories that you had in middle school or high school that really stand out to you in your life, or a funny, interesting story?
Yeah. So in terms of for me in middle school and high school, a lot of what I did was actually in music. So I was pretty driven. I knew I wanted to be a doctor. I knew I was going to own, like, that would be my life. But
And music helps you get smart, kids. Don't forget that.
it does, and it teaches you a lot of stuff. So I actually did more in music than I did in science and math when I was in junior high and high school. So a lot of performance. I did piano and percussion. I was the stage band and on the drums and things. So I did a lot of different music, but accompanied choral music was a lot of what I did on the piano. And I developed performance skills, and which is what I use when I present a lot. And I really use a lot of what I learned about performance from what I did in junior high and high school. And I also learned, I had the ability to kind of take on a lot. So I remember times where I ate dinner at the piano on the weekends because I would practice 4 hours a day. And it was more than what I spent on my homework. And that actually gave me the capacity to do the other things, and it gave me friendships.
So I wanted to ask, like, what would you recommend for a student who's in middle school, transitioning to high school? Like, what type of classes would you recommend? And you'd probably say, I figured you'd say AP chemistry and AP biology, but it sounds like you're saying take music class or take something that really interests you.
Yeah, because you never really know what you're going to use your skills for. And you want to also enjoy what you're doing. So one of the things that I did, which it isn't available right now in the same way, but I did college in 2 years. And so they had at the time what they called a 6-year combined bachelor's and MD degree program. There weren't very many in the country. I think there's somewhere around 50 to 75 slots throughout the country at the time when I was doing that. Now they're more like 7 and 8 year programs. So I was accepted into college and medical school at the same time when I was in 11th grade, or maybe beginning of 12th grade.
Oh my gosh.
So what you then did was you did college in 2 years and 4 summers. So when I was in medical school, my summers were spent taking college courses. Now, that's very compressed, but one of the ways they do that is the pre-medical requisites are the only science and math you can take. And you took them only with people in your program, and they brought professors in from the medical school. So they were very advanced, they were very advanced classes. Everything else you had to take in other areas. So, I minored in French. I took xylophone lessons with someone who was in the Boston Pops and Boston Symphony Orchestra, took private lessons because
What?
it didn't matter what your grades were. You just had to maintain a minimum grade, which was hard in the 6-year med classes. But I could take sociology classes. The idea was to be a Renaissance physician. And so my sister actually went through the program too. She went to France and took cooking classes for a semester during the summer. So there were all these things that we were encouraged to do, to just do things that you want to do, to enrich yourself. And I think that was a really good experience.
David, all this time I've known you, I had no idea that we could have been having a jam session. You on the keys or the percussion and just playing a bunch of music. Do you still play music today?
I didn't cut my hair through junior high and high school. My sisters wanted me to be a rock drummer. I wasn't actually very good on the drums, by the way, but I did different things. And I think that's really important because if you just think about what you want to do in the future, but don't do what you want to do at the time, I don't think you'll actually ever really be happy in what you're doing, and you won't really know what you want.
And I think you make a good point too about we were just kind of talking about the way that things that you're learning kind of overlap and can actually make the learning in other areas better. Like practicing your music and performing your music made you a good presenter and performer, but also I'm sure that those skills come in really handy when you walk into a room with a patient.
Yeah. And when you talk about embarrassing moments, one of the embarrassing moments I had was in high school in my last year. I accompanied the concert choir, which was actually a competitive group in our school. It was very, over 100 people. You had to audition to get in. It was hard. and I was the accompanist. And the conductor announced that I had been accepted to Juilliard. And everyone was applauding. And I just said, I didn't apply to Juilliard. Like, I'm not going to. I'm not studying music. I'm going to a 6-year med program. Everyone assumed that I was. It was just embarrassing to have to say.
How embarrassing.
No, I did not.
I hope that never happens to me.
Yeah, but I didn't apply. But it's interesting because the first faculty position I had, which I was at for 16 years, was at Yale in the School of Medicine, and in developmental behavioral peds.
I've heard of that school.
You've heard of it. So one of the faculty candidates came to apply for the position. She ultimately did get in, and she was from my high school, but she was a couple of years before me. And she just walked in and she said, I thought you went to Juilliard. And I'm like, this myth is just not true. So it followed me for years. But I think the thing is, I found that if I do what I really enjoy, that encourages me to find what really interests me and that I enjoy in the work that I do. And that's something that behavioral pediatrics, when I started, was not a well-known field. Wasn't really fully recognized. But I've been able to be part of that field and then help define it. And so I think that, I know for me, I like to do things that are novel. Or I like to do things where I'm learning new things.
Yeah. Well, you heard it here first, kids, on the podcast. Dr. Schonfeld did not go to Juilliard. So we got that cleared up.
I didn't even apply.
Yeah, right.
I didn't send away for the application.
But speaking of applying to schools, so you have 2 kids, you have 2 daughters, correct?
Correct.
Yeah. So if they came to you and said, hey, Dad, we really want to go to medical school, like what would you recommend as far as like 12th grade, you're wrapping up 12th grade, you're going to graduate, and then summer, and then what? Like freshman year should be where? Like how would you make that bridge from high school to pursuing medical field?
So my kids told me from a very early age they did not want to be physicians. They told me because I worked too hard, and they didn't want a job like that. It's interesting, just as a digression, my oldest daughter didn't know what she wanted to do. She went to a college. She was interested in anthropology, and then she went to a liberal arts college, and they eliminated the anthropology program before she arrived. And so she did sociology. And then she wasn't sure what she wanted to do. And then she had heard of, qualitative market research. So she talked to one person and applied for one position and got it, and did that for, a number of years, became really good at it. They were sending her out of state for extra training. She's had important clients. It was a top named company. And then she decided, I don't want to do this. I thought about it for a couple of weeks, but it wasn't really what she learned a lot from it and a lot of good skills. And then she decided she wanted to do counseling, and she's now a marriage and family therapist. And I just remember because she went to some event that I was speaking at for USC, and she went to USC for graduate school. And so she just kind of said something about following in my footsteps, and now she's doing the same career. But she didn't get to it in the same way. So I guess what I would tell people, when you're in high school, if you don't know what you want to do because there's so many things you want to do, that's great. I think it would be kind of sad if you really didn't have anything you wanted to do or only had one thing. So I tell people, go to, there's a lot of tendency to say, I want to go to the top program I can get in because that'll help open doors. And, in some areas, like maybe going to the best business school so you make connections with other people in business, there is some strategy to that. But if you're going to go into a helping profession, you just really need to know how to help people. You'll find your way into a good position. And so I just would tell people, try not to listen too much to what you're supposed to do and figure out what it is you want to do. So if you want to do something in sports for a couple of years, and or if you want to do something in the arts, or you want to do something, you want to be a writer, pursue what brings you passion, and also figure out how you make a living. So but I wouldn't just go, I don't think there is a set, there really isn't a set career path anymore in medicine. And in retrospect, probably the 6-year program, that's why they stopped it. I think it was just it was hard for people, in 11th grade to figure out what they wanted to do for the rest of their lives. And
That's a good point. Yeah.
so they don't offer it in the same way now. The advantage of it was you didn't have to spend college trying to get into medical school. You already were in medical school. So that was the advantage. So now they have more 8-year programs.
That's great. Yeah, I mean, I didn't even know I wanted to be a counselor till I was 29, just about to turn 30. And I was like, oh, I'm almost 30. I better get my life together, go to school, stop watching South Park. It's a comedy
You can keep
show.
watching South Park.
Okay.
It would actually be a good time to watch South Park. But I get your point, yes.
Yeah. So I feel like I can ask you a ton of questions about school and everything, because a lot of our students are starting to think about it already. We have students taking algebra and geometry now, preparing for high school, but I think we'd be very remiss to not have someone of your experience and knowledge on the podcast, and to ask questions about, a lot of students right now are struggling in this environment of remote learning and being isolated through the pandemic. And I know that you have offered wonderful, we'll link your whatever website you feel is appropriate on our podcast, but you've offered free resources and help for schools about supporting students. But overall, like, through this whole experience of the pandemic, now we're in October already, what are some of the biggest concerns that you have for students in this remote schooling environment?
Yeah. So first off, I think we have to recognize that, yes, the remote schooling environment is a challenge, but it to me, it's probably more that it's a pandemic than it's remote learning. Because, people keep saying it's, if we just get kids back to school. Well, quite honestly, I've worked with so many schools after school shootings and natural disasters, and they actually do get back to school pretty quickly, and it's not okay once they get back. They still have trouble learning. The teachers are still very stressed and having trouble teaching. The parents are anxious. So I think we have to recognize that it isn't just that kids are having to use a lot of time on the computer. It's not just that they're socially isolated. It's that people are dying, and this is a crisis, and it's scary. And I think we kind of have to first start off with, I think that's the primary problem. And I think that there's the additional stress that comes from being physically and socially separated from others. And
I'm sorry, I just have to pause for a second, because that is just like so liberating for me to hear. Just like, as somebody who works with kids and works with, in a school, and is, like, oh, I feel the pressure of, like, as a school counselor, like, oh, I got to get back and see my kids. And, like, this is just like the hardest way to interact with my students. But actually, no, you're totally right. The thing that's difficult right now is that we have a pandemic. It's not that we're remote. That's such a great point. And
yeah, because I
appreciate you saying that.
You can have students who go to Europe, for a semester or something like that, or they have, let's say, their parents' job takes them someplace in another country. I have some colleague now who's in Africa with his children for a year. He arranged that before the pandemic, but it is another challenge now. But they can thrive in those situations and enjoy themselves. I think kids are pretty resilient, just like adults can be resilient, and they can handle using remote techniques better than adults can, to be honest. They're kind of used to that. People say, well, how do we stay connected with kids when they're remote? And like, have you not recognized they use social media, like, and did before the pandemic? Like, they can teach us how to do this better, but it is hard.
That is absolutely true.
Yeah,
I need to come up with like a school
That's absolutely
counseling
true.
TikTok.
I'm sorry?
I need to come up with a school counseling TikTok.
Oh yeah, well, my younger daughter works in New York City, and I'm in California, and she came to visit in mid-March. We were supposed to go on vacation together, and the pandemic was just starting, and I said, get on a plane tomorrow, like, come here. So she came for a week or two, packed for a week or two, and she's still here. She's working remotely from here. It's a little challenging because she has to wake up really early, because of the 3-hour time difference. But one of the things that she did, so she has an apartment in New York. She has a roommate. She has, a job in New York, and all of her friends are there. So figuring out how to stay connected with them has been a challenge. And she started with TikTok. And she actually is up to, last I heard, 4,000 followers and live streaming, and really, spends her entire weekends creating TikToks, and there's costumes arriving and props and stuff every
Dude,
week.
What's her handle? We could get her like 800 more followers.
Well, maybe
just
I'll
from
send
Alderwood Middle
I'll have
School.
to ask permission.
I'm just kidding.
So yes, TikTok was the way she did it. That's how she stayed connected with a social network and could create something that she found creative and express herself. And so I think, yes, we can figure out how to do this. But to get back to your question, yes, of course, it's difficult to make change in a crisis situation. Some of the remote learning is not ideal, to be honest. And so the changes were made quickly, and they were done by people who were not necessarily experienced in doing remote education. And so, and they're also not at their best either. They're pretty stressed out. It's interesting. I've been on so many Zoom calls throughout all of this. I've done already well over 100 webinars related to the pandemic for schools across the country. But every time I'm in meetings, the number of times there's a kid that comes into the picture, usually a toddler. I did have one that came in, he had just broken his mother's cell phone and thought it would be a good idea to present it while she was on camera with witnesses. So he just came candid, and she goes, he did that so that I can't complain to him or punish him. So, the issue is, the kids will come in and they always say, I'm so sorry for the interruption. And I keep saying, I'm a pediatrician. You never apologize to a pediatrician for paying attention to your children. Like that's what we want you to do. But the challenge with a lot of these teachers are taking care of their kids. They're worried about older relatives and stuff. So they're stressed out. So they're not always doing their best, to put it mildly. And so, yeah, so
I should mention too. Go ahead. Sorry.
No, please.
Oh, so one of the things that our principal's done to connect with students is started TikTok as well. And I don't think if it wasn't for the pandemic, we could have ever had our principal make a TikTok video. But it was like one of the most wildly popular videos, just virally going through our school. And it kind of makes me think too that we're learning new ways to connect with people, like you said, that I don't think I would have been even able to ever do a podcast or even know how to connect with students on this level if I wouldn't have been forced to do it through this struggle. And we forget sometimes, just like you mentioned, students are resilient. And when they go through tough times and when they go through stressful times, that is also an opportunity for them to grow and become stronger.
Yeah, we call it post-traumatic growth, and individuals who are in stressful situations, either from crisis or loss, often emerge from that with new skills, new resiliency, new coping techniques. I remember hearing somebody interviewed, he was a religious leader, and he talked about the fact that he was really good at what he did because his kid had died. And he learned at that point what empathy was, and how to support people, and how to really be the best at what he was. He said, and he's known internationally, and he just said, I of course would give up all of that skill and get my kid back. But so I don't want to ever say it's a good thing. It's just the best outcome you can get from a bad situation. And so we're changed by these events. We're permanently changed. I mean, yeah. Nobody's going to forget that they were, that they went to school during the pandemic, but they may emerge with new coping skills, resiliency, better able to deal with adversity and loss, more empathic. If they can learn how to connect with people at a distance, it's going to be even easier when they're back in person with them. So I think, I remember I was talking to some reporter, and this particular reporter for a very well-known international newspaper was kind of saying to me, I'm really concerned because my kid's is in daycare, and I'm noticing that now, even if you have someone come into your home or they go to a daycare program, they're wearing a mask. and my kid's a toddler. How are they going to develop social relatedness? They're not going to be able to see people's facial expressions. They're going to be, damaged. And I just said to them, well, let's be honest, in some Muslim communities, the women wear veils. I mean, the kids figure it out.
Good point. That's a great point.
And I said, we're stressing. Yeah, it's not as easy, but actually most emotional expression isn't around your mouth. It's more around the eyes, but that's a separate issue. And so I just said, they'll learn other ways. And when they get home, their parents won't be wearing a mask in the house, and they'll pick up those social cues. So yes, this is a difficult time, but children can figure out how to adapt to it. And
so I do have a question. So I know with post-traumatic growth, one of the important features is as you're going through the trial or crisis or stressful event, is you should avoid adapting maladaptive coping strategies. So that's a fancy way of saying unhealthy habits to cope with with everything that you're dealing with. But it's also important that schools and parents play a role in that. So I'll start with schools. What are some things that you're seeing? You work with a lot of different schools across the nation. What are some things that schools are doing that you see that are specifically helpful or incredibly helpful for students?
Yeah, so one of the biggest things in all these crisis events, but in this pandemic as well, is we have to kind of recognize that kids are not going to learn as much information, and teachers are not going to teach as much information. And, the world has changed, and so the curriculum has too. And so we have to alter our expectations. And I think schools that deliver that message most effectively, that say, look, we're going to give you a good education. We're going to meet you where you're at. We're going to continue to challenge people that are ready to learn even more. But we're going to recognize that you might benefit from a little bit more assistance and support, and we're going to do that too. And I think that message has to come from the superintendent, from the principal, from the teachers. And I think it also, the trickiest part, and I spend a lot of time on this when I'm working with schools, is I think the teachers have to accept it for themselves, and the counselors have to accept it for themselves. There's only so much they can do. And if they're doing good, that's good. And they're not going to be able to take care of everything for everyone. And quite honestly, even before the pandemic, they weren't able to either. So I think the most important message is to be honest, to be genuine, to be authentic, to acknowledge the fact that this is difficult, to not pretend that we can go back to the way we were. And I also tell people, please don't use the term new normal, because there's nothing normal about a pandemic. And I think whenever you say it's the new normal, it suggests we're supposed to be okay with this. And I'm not okay with it. I don't think there's anything normal about it. It's our shared reality. And we have to figure out how to deal with that reality the best we can. But I don't call it a new normal. And the other thing I've been telling people is everybody keeps referring to us as where we are in the recovery phase. I don't think we're in recovery yet. I think we're still dealing with the pandemic. I think it's evolving. It may actually get worse. And I think if you tell people that we're in stage 3 of recovery, it suggests you should be getting over this by now. But I don't think people are ready for that yet. So I think we have to have, for me, probably the most important thing is realistic expectations, honesty and authenticity, and then providing the support and assistance. Because the post-traumatic growth requires not only personal resiliency, but actually adequate support. And so we need to accept that.
Can you talk about specific supports that offering to students would be helpful? Like at our school, we actually do offer a lot of groups. We're all trained in CBITS, for example. So students that are experiencing trauma, we have a group for them. We provide groups on anxiety. We know there's been increase in anxiety. We try to offer a lot of groups for students to join that sometimes are just social and fun to maybe help with increase of depression. So offering groups is something we've tried to do. What else do you see, as far as specific ways to support the students? Individual therapy might be one, but what would you recommend?
Yeah, so part of what I'm arguing now is this is affecting everybody. So there is a tendency in schools to kind of use what I call the medical model, which is we try and screen people for problems, we identify it, we evaluate, we diagnose, we treat, and we refer. And that does not work in crisis situations like this for the vast majority of people. And we really have to kind of do more universal supports. What are we going to do to help everyone without trying? They don't have to say that they're abnormal, they're struggling, they're doing poorly, they're abnormal. I think it's normal right now to be distressed. It's a distressing situation. So I think we all have to figure out what we're going to do for each other and for ourselves. Because so a lot of the groups that you're talking about, some of you describe them for social function. That's great. That's what we want to do. We want to build social connectedness. We want to do that even when kids aren't having problems. I mean, I mentioned all the stuff that I did in music. That was my social group for a large part. And I didn't do that because I was socially inept or because I was musically challenged. I did it because I wanted to do it and it was fun. And that's what we need to keep doing. So I do agree that we need to have our support staff and really all of the staff in the school better able to help kids who are feeling distress, worries, anxiety. We need to help them learn coping strategies, but I think we need to do it in a way that doesn't suggest that they have some disorder, problem, or disability, but just because it's a hard time. So, part of what I did, for example, is my older daughter is in Southern California. That's one of the reasons I'm here. And so just made a decision. I've been working really hard and I work like 7 days a week, but actually Friday afternoons she's off. That's the way her schedule works. And we get together and spend time with her dog. We have to do it outside, physically distanced with masks. We go out for ice cream. You walk up to a window, you order on an app. It's like, it's safe. But so when people ask me about my schedule availability, that's not available. Like those couple hours, because I realized otherwise I'm just going to work nonstop and I'm going to lose it. So there's a certain amount where I'm not in therapy, but I'm scheduling something that allows me to have some, time that will be helpful for me.
Therapeutic.
Yeah, and so
yeah, you can do things that are therapeutic that aren't therapy.
Right. And now you want the professionals to understand the therapeutic skills. And obviously there are some kids that are going to benefit, want, and even need more. And then so CBITS is it's cognitive behavioral intervention for trauma in schools. So it is a treatment approach for individuals who are having symptoms of post-traumatic reactions or post-traumatic disorders. We need that for kids who have that, but we should be teaching coping skills to all children because all children are going to have stress. And they're going to have things which are going to cause them distress, but they're not necessarily a disorder.
So one of the you mentioned universal support. So one of those would be universally teaching coping strategies to all students, for example. What are some other examples of universal supports that are helpful for kids now?
Some of it is we need to teach kids strategies for dealing with distress, and so that might be things like expressive methods to be able to express what's bothering you, safe ways of distracting yourself that are healthy. You can do mindfulness techniques. You can use guided imagery. So you can teach those techniques. I actually got some training in to do self-hypnosis with patients. And I taught my kids when they were young self-hypnosis. Not because they had any problem, but just, frankly, I thought it was a little more interesting than reading the same book every night. It just, for bedtime, it would be more, let's go imagine that we go to that special place. And, I wasn't hypnotizing them, but I was teaching them how to use that skill themselves. And they ended up using that. I didn't consciously do that, but I remember my daughter was, I think, 7 or 8. She had to have 4 teeth removed. And she went into the dentist and I asked the dentist, can I come in and use some self-hypnosis coaching with her? And he was like, sure, I don't care. So I did that with her. And they used Novocaine. I mean, they had injections of Novocaine. But I remember at one point she just turned to the dentist and she said, when are you going to get started? And she was bleeding from 4 holes in her mouth. So I don't understand. And he was like, we're done. And she goes, I didn't know you started. And I've just never seen that. And she was so proud of that that for a while she wanted to be a dentist or a dental hygienist. She was
Cute.
like, I like going to the dentist. I'm proud of going to the dentist. And she's never had a cavity. And so she only had a good experience. So you can teach people, the mindfulness techniques, yoga, use of exercise, all of these strategies are ways to manage, how you feel and how you cope, in addition to everything else that they can be used for.
And I think what's important about what you're saying too is, there's all these different strategies and there's not like a magic bullet. Like there's not one that works for every single person. And so it's so valuable to get to try different things and to kind of experiment and see what fits for different people too.
Yeah, I will say is that sometimes that isn't appreciated by people. They have like their technique and they want everyone to do it. They're like, everyone should do yoga. To be quite honest, I have some middle ear dysfunction. I've never been able to do a forward roll. I never could do it. I have never actually done it once. I fall over. There's something about my middle ears. So I don't want to do yoga. People say you stand on your head. I would just get nauseous. So that's not going to work for me. And I had some people talk about, well, you just have to take deep breaths. Well, I actually have cough variant asthma. And so when I take a deep breath, I feel like coughing. And so I actually dislike it because people will say, take your breath, and they start counting. And I'm just sitting there going, I'm going to start coughing. Like, I don't want to cough in the middle of a conference when everyone's holding their breath. So, I said this to someone, they said, all you have to do is deep breaths, belly breathing. And I said, it doesn't really work for me. Like, I'm sure it works for some people. I understand that. It doesn't work.
And I would guess also to, your expertise as a developmental behavioral pediatrician that also maybe some of these might work at different stages of people's lives. Like, maybe something that I do when I'm, 5 years old to help calm myself down doesn't work when I'm 30, whatever,
Yeah, it's true. I mean, people have different developmental capabilities, but one of the things I will say, when people are highly stressed, they regress. And so what made them comfortable at 5 is probably what the 31-year-old really wants to do. They may not feel they can suck their thumb or whatever, but it may not feel appropriate. But actually, a lot of what you find is people who are really stressed as adults, they home to the parents, and they want to be taking. I used to remember I used to do this when I rarely would get ill or allow myself to be ill or take the sick role. I always push myself. But every once in a while, like maybe once every 5 years, I would decide I could do it. Like I had the flu, I had a fever, and I didn't have to be somewhere that was really important. So I would go, okay, and I would announce I'm sick. And then I would go through the same thing, and I would say, I want, cinnamon toast, and it has to be white bread, and the crusts have to be cut off because that's what my mom used to do, and I need them in triangles. And my wife would always look at me and go, we don't have, I go, well, you go out and you buy it. Like, I am sick, this is what you do. And I wanted ginger ale. It had to have a 6 straw that bent, because, and that's the only time I would use them. And at one point I found my wife had this stuff and she hid it for waiting for the next time. And I found it and I go, what are you doing? And she goes, well, that one day you will ask for the 6 straw. And I go, when I ask for the 6 straw, you go to the store and you buy it. Like you don't plan for me being sick. When I'm sick, it's inconvenient to you. But I mean, the thing is, she understood that. And that's what my mother did, And so part of what I will say is, if you find strategies that work for you now, you got them for the rest of your life.
And I just want to say, I think I'm in the developmental stage in my life where I'm ready for self-hypnosis. I want to try that. I actually remember the first time I talked to you about self-hypnosis or hypnosis in general, because when I think of hypnosis, all I think of is like a state fair where there's a guy and there's a stage and he's taking people who are susceptible from the audience and he's making them dance like Lady Gaga on stage. And that was my interpretation of hypnosis. But David was actually like, no, it's actually a well-researched methodology that is evidence-based. And I was like, what? Like, no, I couldn't even imagine that. So I appreciate the idea that there are multiple different ways that people can access those same strategies. I want to ask too, so I imagine, for schools, it's helpful to teach different ways to deal with stress and coping. And if you were to give recommendations for parents, that would probably be one of them that you gave for parents to help their students walk through that. But what additional advice would you give specifically for parents to help support their students at this time?
Yeah, so I think parents, well, first off, people always say that, crisis brings out the best in us. I have been to so many crisis situations. It actually usually doesn't. It usually just brings out people's distress, and they're usually not as pleasant.
The opposite, yes.
Yeah, I mean, that's the reality. We're not at our best. And so part of it, again, is I think parents have to have some humility. And, they're going to say something really stupid, and they got to just say, hey, that was pretty stupid. You can just imagine a kid's going to say something like, oh, it's not fair. I don't get to start playing soccer, and people don't understand, and I'm stuck in this house with you. And this is really ridiculous. No one ever had to do this before. And you get a parent who just gets frustrated and says, well, you should just be grateful no one died in the family. Like you don't have any right to, you should be thankful. Well, just the fact that somebody died doesn't make them feel thankful. I mean, they still can't play soccer, or they can't have their graduation, or they can't celebrate their birthday. And so I think there's a certain amount where I think parents have to just realize, don't try and make your kids feel guilty for being human. Acknowledge the fact that this is difficult for everyone. Set some appropriate limits. You can't use drugs. You have to put some limits for safety. And then try and connect with your kid. I've filmed. My daughter started doing TikToks. I started filming TikToks. So I wouldn't have done that before. It's not something we would have ever shared. But so part of it is, try and find something that you can connect with your kid with during this, where you're actually having fun. Try and do that, and stop beating yourself up because your kid isn't finishing as much of their homework or isn't progressing as much toward their career. I find it fascinating that people are writing articles about the fact that, kids are going to lose earning potential because they're going to all lose, 6 months or 9 months of learning. And I feel like saying, everyone is. Who else do you think is going to get those jobs? I mean, like, it's not like the people who went to regular school are going to now get the jobs and you're going to be stuck. I think it's affecting the entire world as far as I can tell. So there's a certain amount where we just got to kind of, I want to say chill out, but just recognize that this is what it is. Stop fretting over what it isn't. Figure out how to keep safe, how to keep healthy, how to show your concern for each other, to take care of yourself and those that you care about. And if you're doing that, you're doing a good job. And we will get through this.
That's great. We solicited questions from our staff and parents to see if there were any questions for you. And there was one specific question that we chose as being really pertinent, because I think there's a lot of people, parents specifically, and even staff, who are really frustrated about remote schooling and having to resort to that. But one staff member anonymously submitted a question. And this individual listed a ton of research and data specifically on COVID, and specifically on the rates of infection for children, and how it's so minuscule of a chance. And, from the CDC, I mean, it was probably 20 different articles that this person referenced about how minimal the danger for students that COVID-19 is, but that the conversely, the isolation and the remote schooling, how detrimental that is like, really, is our society making the right decision, or our districts, are we making the right decision by doing remote schooling? Or is it offset by how susceptible kids are to becoming sick?
Yeah, so, the American Academy of Pediatrics has put out several times interim guidance on school reopening. And I actually participated in each of those groups. They were small groups, and I was part of the groups that tried to figure out how to balance that and to give some of the guidance. And I see the truth in both sides, but I also saw that sometimes people were debating and arguing. They had a particular view of what they wanted, and they were pulling the research selectively. So I do remember at one point there was more of a push for some of the people to say, you know, schools are really safe, kids don't get that sick. And I remember somebody said, well, that we haven't really had outbreaks in school. And I just said, the schools are closed. How would you expect there to be outbreaks? I'm not aware of a single outbreak in a bowling alley. I don't think I would tell people bowling alleys are safe, and that's evidence-based. You know, I don't know that we've had a single outbreak in a movie theater that's been traced to that, but from what I know about the virus, that's not a good place to be if you can't keep distance and masks and ventilation. So I guess I was one of the people that was saying, what we need to do is we need to put guidance out that's based on actual reality and not based on what we want to happen. And so I was concerned, you know, that there were comments being made about, well, you know, there haven't been these outbreaks in schools. Schools are safer. The outbreaks are, you know, kids are catching it from home. And I'm like, because they're home. Like, that's where they're going to catch it. And I said, and you know, people saying, well, schools are safer than home. And I go, well, wait a minute. Like, they still have to go home at night. So if they're going to catch it at home, all you're doing is saying that they won't catch it for the first 8 hours, but the other 16 hours they'll catch it. So I'm like, that doesn't even make sense. So I guess what I'm saying is that people are really passionate. They're scared. They're a bit overwhelmed. And what I will say is that the research does suggest that young children are less likely to transmit it as effectively, and that they're less likely to get seriously ill or die from this. I think older children, middle school and high school age, are likely to be able to spread the virus. So I think it doesn't spread as effectively from a 5-year-old, but it will spread more effectively from a 15-year-old. And individuals who are, you know, middle school and high school are less likely to get seriously ill or die from this. It does happen occasionally, but it is much rarer. But with all of that, they can spread it to adults too, who can get sicker.
Yeah, you know, I was going to say that just as you were talking, I was thinking about that with the whole debate, risk versus reward of keeping schools closed for this long, is that whether or not it's a high mortality rate for children or not, or adolescents, these adolescents live with family and parents that could have health problems and risk factors. I know a lot of students who live with their grandparents or are being raised by their grandparents. So if it's difficult for them to do remote schooling, think how much more difficult it would be for them to start losing older family members that are their guardians. That would be an even worse dilemma.
So one of the things I think we have to be really cautious about, and I don't think we've done a very good job internationally on this in terms of the messaging, is there's been this frustration that we want people to follow certain rules in order to decrease the risk of infection. And it appears very difficult for some people to do that. And it also appears that over time, youth have been more likely to not follow those rules in some situations. And so people have then turned to what I would call fear-based messages. So making comments such as, if, you know, maybe if you go out, you won't get sick, but every time you go out, you know, get a visual image of your grandparent and know you may kill them. Well, the problem is that when somebody dies, people always feel guilty and wonder what they did or didn't do or should have done that would have changed that. And we're setting these kids up to feel just incredibly guilty. So I told you my daughter came home from New York City while the epicenter was I was starting to become the epicenter, and she wouldn't hug me. She stayed away for 2 weeks. I mean, she took her temperature every day. She was really worried that she would infect me or her mother and that we might die from this. And that's a burden that a kid shouldn't have. I mean, she's an adult, but an adult child shouldn't have that. And when I picked her up from the airport, I saw that happening with other families. 20-year-olds were getting off of planes at the airport. You could tell their parent was picking them up. They'd go to hug them, and the kid would say, "Don't hug me." So I think it's true that, yes, they can transmit it, but I really want to make sure we're not trying to set them up for guilt that's going to be really difficult. And I think what the message should be is, look, we know that some people can get very sick from this, and some people can even die from this. And that's why we're making the sacrifices that we're making to try and decrease the transmission. these are some steps that we've decided as a society or as a family or whatever that we're going to follow. And I want you to follow that. But if you follow that, you're doing what you ought to do. And so I just think we have to have shared responsibility. And I think what's happening is, kids will test the limits just like adults do. Look, we see that with a lot of well-known adults. They're breaking the rules. They're pushing the limits. So I don't think we should be surprised that kids are doing that. I'm not sure that that's because kids don't follow rules. I think that's because they're people, and people test rules too. So I just want to make sure that kids should do what's right for them and what's also right for their society. And I think in general, they will, just as well as adults do. So we just have to be careful. I don't want to layer any level of guilt on kids, because I think guilt is just so common right now. And a lot of my work is in bereavement. And I've done that for 30 years. And I've only found 2 cases where I didn't find guilt among someone in the system. And so I just really want to, everything you said is right, Josh. Kids can spread this to adults. They can spread it to other kids. And they can also get sick themselves. And for all of those reasons, they should take the right steps to keep themselves safe and those that they care about, and those they don't even know. Because I think that's the other thing is, they don't want to spread it to their parents, but I don't want them to spread it to somebody else's parents or a stranger that they don't know. We need to contain the virus to the best of our ability.
And I think, and correct me if I'm wrong, but I think what you're saying is kind of to let's look at this as a community health issue, as opposed to it's these individuals that are interacting with these different systems, but let's look at this as a community and what makes sense for a community to address this.
Right, and there are many public health measures we put in place. You don't drink and drive. You wear a seatbelt. It's to protect you. It's to protect those you care about, and it's to protect people you don't know. And I think those are all really important things. And so we have to try and do it in a way where people are motivated to do the behaviors because they understand why it's important. And quite honestly, that is difficult now because there's a lot of very mixed messages and things have become very politicized. And so it's hard to know what really is, I get people, I've done over 100 webinars on this. And people will be asking me questions that really have to do with public health questions because I don't know that they trust any particular source of information right now. And that I think is a big issue and is what's making it so confusing. So yeah, you can find 20 studies that say transmission doesn't happen much in schools. And then you can go look at the literature of the outbreaks that happened in Israel and elsewhere where it did occur. But I think the main thing for me when people talk about the fact that other countries have had students in school without masks and without a great deal of physical distancing and have done fine, those are in communities that don't have the prevalence that we have. So I think it's just so widespread right now that that's what we should be talking about. Is let's get the spread down. Let's contain it throughout the country. Then we can start to open up more.
Wow. This has been an amazing resource for us. Thank you so much for your time. I know you're a very busy man, and I want to let you go if you need to, but we had another 5 minutes of funny questions if you have to go, that's totally fine.
No, we can do that. Let me just check. I think I'm fine.
Okay.
Yep, I have time.
Okay, great. Excellent. Okay, so just a couple quick questions. We had a student submit a question. What does a pediatrician dress as for Halloween? So in other words, what was the last Halloween costume you remember dressing up as?
Oh, that is a good question. I'm going to be honest. I once dressed up as a bunny rabbit when I was in a training program. I was in my residency. I was at a children's hospital. And when you're in children's hospitals, they dress up a lot. Like Child Life is there. Everyone's in costumes, And I was dressed up as a bunny rabbit, but I was supposed to go see a kid who had been raped, and I just couldn't do it, So I took the costume off, and that was the last time I tried. It was just kind of like,
oh my gosh,
it seemed so insensitive, So, and it really wasn't that great a costume, to be quite honest. But I don't actually dress up as costumes in work. And I don't usually have much of the opportunity to do it outside of work. So sorry, that's a bummer, but I just, to me, the other thing we always have to be worried about as pediatricians is you don't want to use any costumes that frighten children. Sometimes even clown costumes do that. And also I'm kind of a little shy, so I don't usually dress up, to be honest. Sorry about that.
Okay. All right. No, that's fine. We get it. We had a mom ask, why did the pediatrician cancel my appointment when I was only 5 minutes late? And she had a response. She said, because he had very little patience.
Oh, yes. Okay. Yeah.
Not patience, but like little patience. Doctors have patience that they take. Yeah.
Yes.
I know you get it, but I want the kids to
I get it. Yes, I get it. Because I was going to say, what pediatrician would cancel after 5 minutes? Like, we don't do that. But.
Yeah. Okay. And then one more, we have a question. So this is a multiple choice question for you. And it's about youth vernacular, youth lingo. Okay. So I'm going to read a statement and then you have to guess which response is the appropriate youth lingo. Okay. So here's the sentence. So you're out with your friends playing putt-putt golf, and someone says, I can make this putt with my eyes closed. Is the appropriate response A, dink and flicka, B, bet, or C, p-gap? A, dink and flicka, B, bet, or C, p-gap?
Oh God, I am not good at this. I'm gonna just have to guess bet because that has the least chance of being a humiliating answer.
You are right, sir. That is
Nailed
actually,
it.
I don't know the other ones, so who knows what I would have agreed to.
Look at, you learn something new every day, Dr. Schonfeld. That bet means like prove it.
Oh yeah, that I understood. Do the other ones mean anything, or were they made up?
Dink and flicka doesn't mean anything. It's from the show The Office,
Okay.
and p-gap is our professional growth goals that we have to complete every year as counselors.
Okay, good, because I had no idea what they were. All right, bet I knew. Yeah, like I would say that perhaps.
Excellent. You just gained a ton of cred with all the youth
Good,
in our
good. I like
audience.
street cred.
Great. All right. Well, we better cut it short. Thank you so much. We've gone so long. This has been awesome. I feel like I have 10 more questions to ask, but I definitely will link your resources on the podcast.
Yeah, let me mention one other thing to you in terms of resources. So the National Center's website is schoolcrisiscenter.org. We actually have a COVID-19 resource page. You just click on there's a banner on the top of the website that'll take you there. And that does include some presentations on how to deal with crisis and loss during the pandemic. And we just added one that was for peers. So I developed that. It's going to seem more like a little lecture. It's about 30 minutes long. And we did that because I was asked to talk to some high school students that were taking college classes at USC. And so they were peer leaders and they were taking college classes to be, these were actually students who came from families that didn't have family members who had gone to college before. So they were first generation college students was the plan. They hadn't gone to college yet. So it does seem a little bit like a lecture, but it might be something that if you have students here who want to figure out how can I help advise or support my peers, that's what it was put up there for. So if that will be useful, it's about 30 minutes and it's a narrated PowerPoint presentation. So it's not particularly fun to watch, not like I'm sure this podcast will be or the other ones you make.
Sounds fun to me. I'm telling you what, I can't wait. I watched a lot of your other videos and I've forwarded it to counseling colleagues and it's outstanding. And it's been I've heard rave reviews from everyone I shared it with.
Oh, great.
Yeah. It's so nice to meet you. And honestly, just thank you so much for all your work. Because it's clear that you are doing so much to bring light to what kids across the country need in really, really hard situations. So I just appreciate, I'm thankful that, that this is like a path that brings you joy too. You know what I mean? Like clearly, like you said, like you feel like you're in the place that you're supposed to be and learning and studying and teaching the things that that are important to you. And those things happen to be also very important to our community. So I just appreciate you, and thank you so much for what you do.
I do want to acknowledge all that you guys are doing, because you're the ones who are actually providing all the help directly to the students. So that's really critical and important. And I've worked with Josh for a number of years, and I'm very impressed with what he's been able to do. So if I can help, that is my pleasure.
Oh my gosh. All right. Well, we need to have you on more often, sir. So anyway. All right. Well, thank you so much, David. Have a great weekend and a happy Halloween. Hope you consider wearing a costume this year.
I'll think.
Right. So long.
Bye-bye.
Okay. All right. No clowns. Bye-bye. Wow, that was really cool. So I learned a lot. How about you, Catherine?
Oh, totally. Well, I'm like writing, in the other podcast, it's like, okay, what's the next question? What's the next question? And this one, I'm like taking notes the whole time and like excited to just talk with you. So yeah. This one is going to be a tough one for me to chunk out. So usually when we do the podcast, we have the whole podcast, which we'll make available, but then we offer individual clips. But I was taking notes, and I have like 8 different segments that I'm going to probably have to create individually, because this one was so rich and helpful. Yeah.
Yeah.
Absolutely. I'm sorry. Right. I'm just seeing that another kid is, I have to leave.
Yeah, I'm going to. Okay. Too. It was so nice seeing you.
David's here. Okay. All right. Thank you, David. See you later.
Thank you. And I gotta go too. So bye, y'all.
All right. Bye, kids. Have a good weekend. We'll see you later.